Peyronie's disease is a condition that affects the penis that causes curvature that never used to be there. I have a group of patients that come in and they say, "Doc, I saw these commercials on TV and my penis has a curve." And my first question is, has it always been there or is it new? If it's always been there and not bothersome, that's just a normal penis. Most penises are not completely straight, but Peyronie's disease is an onset of a new curvature that is bothersome to the patient. And this curvature can vary from 15 degrees all the way past 90 degrees, and so severity can vary patient to patient. Peyronie's disease can affect 1 in 10 men. The rates seem to be increasing, and I think that's because awareness has been increasing. So prevalence may actually be higher than that because it's a very personal condition and men are hesitant to bring this up or may not know who to bring this up to. It's probably largely underdiagnosed. Signs and symptoms that a man should pay attention to or watch out for. One is an onset of curvature, and that may be with or without pain. Some men may feel like a lump or a bump inside the penis. Some men may not. So there can be a lot of variety there. Also, it's often associated with changes in the erectile function. So with development of curvature, whether that be from a psychiatric or like a mental health side of things, is they're having concern or worry about their erection and the appearance of their penis, that can cause some changes in erectile function. But we also believe there may be a correlation to the development of erectile disease from a physiology standpoint and the creation of the penile curvature. Secondary to this, it's a scar tissue formation in the penis. Treatment options, again, are going to be very, very tailored to each man's exact situation. Most often, if it's in what's called the acute phase, or the first 6 months of the onset of curvature, we're going to work on reducing inflammation, reducing pain if it's present, and start working on some stretches for the penis. There is a medication called pentoxifylline, which can help some men reduce the scar tissue formation and the inflammation in the penis, and some men do benefit from that during the acute phase as well. If it's in the chronic phase, or if it's been more than 6 months since the development of curvature, we can think about definitive treatment options. So if a man hasn't had resolution of their curve through some of the conservative things that we have tried, we can do several different options. A non-surgical option would be an injection of a medicine called Xiaflex, and that's put directly into, if a man has a lump or a bump in the penis, we can inject that scar tissue area to help soften that scar tissue and help relieve the curve. If a man has, a different profile to the penis, or doesn't want to do a Xiaflex treatment, or maybe they're not an appropriate candidate for that treatment, there are surgical options that can be extraordinarily effective. The least invasive and the quickest is what's called application. An application is done with a set of stitches opposite the side of the curve, and that helps pull the penis straight. Another type is where we do a procedure that's called an excision and patch graft, and that's where some of the scar tissue is removed and a patch is put on top to reinforce the strength of the penis in that area, and that can help also straighten the penis. And lastly, if a man is having significant erectile dysfunction with the presence of a curvature, a penile implant can be an excellent choice that corrects both curvature and the erectile dysfunction in one. So I think the number one marker for success is taking that initiative to seek care, because a personal standpoint, it may be hard to reach out to a physician in the first place. But that's really where we start to see the success, is just that initial initiative to find the right provider to help with this situation. From there, the treatment options are extremely effective. So with Xiaflex medications, about 70% of men saw improvements in their curvature. And with the surgical procedures, greater than 80% of men see improvement or resolution of the curvature in the penis.